time marching on, we'll proceed to the next discussion, which is equally frequently raised by our patients. What are complementary approaches that may ameliorate symptoms, may avoid the toxicities of the agents that we have? And for this, Kelly Francis will speak. And Kelly, you're on.
Good morning, everyone. Thanks for letting me talk to you this morning. I think one of the questions that I'm asked most frequently in clinic is, what else can I do? Or when we're talking about symptom management, I just don't want to take more pills. And so this is not something that is going to exchange that conversation with your provider or even those medical managements, but just something that hopefully we can use as an adjunct. And I'm frankly not an expert in complementary medicine, but just something that hopefully you can get a conversation started with your provider or stuff you can look into yourself. So let me share my screen here and get started. All right. So just starting off, I want to start with a few definitions just so we know what we're talking about. So what I'm talking about is making use of unconventional. By unconventional, I mean things that are outside the mainstream Western medicine modalities that are hopefully non-surgical, pharmaceutical, but have known efficacy. And this is different than alternative medicine, which would be something that would be in place of a scientifically proven modality. And I think one of the things that is a challenge for us as a big research institution is that we're great with the cutting edge biomedical treatments and we're providing all of these clinical research opportunities, but we kind of failed to address the psychological and the social issues that go along with the diagnosis for these patients and for their families. So hopefully in talking about these things, we can have a more holistic approach to symptom management and to dealing with the diagnosis. So another definition that I'd like to introduce is integrative oncology. And this is a field that is growing within the field of oncology. And we're very blessed at our institution to actually have a wonderful physician named Lainey Francis, who is kind of spearheading this new clinic within within UPMC that is hopefully going to provide some of these complementary approaches for patients. So the definition the Integrative Oncology Society actually provides is it's patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. So the aim of this is to optimize health, quality of life, and clinical outcomes across the cancer continuum, to empower people to prevent and become active participants before, during, and beyond cancer care. So right now we're kind of shifting from just talking about the medicine, but to really approach the patient as a whole person. So here are some different modalities that are used. Melissa talked beautifully about some of these biologically based things, especially with diet. I'm going to talk more about the mind, body, and the manipulative and body-based. So Melissa just talked about the gut-body axis, and this is more about the mind-body. So one of the first things that we talk about is in the mind-body fields are things like therapy, cognitive behavioral therapy, which Dr. Ormond will talk more about later. And this is, of course, not an unconventional therapy in our society today, but something that we're definitely underutilizing, I think, with a lot of our patients. Meditation and music and art therapy. And these things can really reduce anxiety, depression, improve insomnia. They can help reduce chronic pain. In some instances, they can reduce nausea. Another important thing when we're talking about treating melanoma and the immune system is decreasing some of these stress hormones can help maintain the function and integrity of the immune system and other physiological symptoms, which is very important not only in treatment, especially with immunotherapy, but can help patients adjust to cancer treatments and recovery and better tolerate complications that come along with treatment. And some of the newer research is showing that improving immune health and improving mental health can actually have better outcomes for patients clinically. Manipulative and body-based practices, these are more movement-based practices that can hopefully reduce pain and improve mood. So things like Tai Chi and yoga, these are combining physical movement, breathing control, meditation to just promote relaxation and improve physical function. Massage Of course, there's the massage we all think about going to get a full body massage that could help promote relaxation. But there's also things like manual lymph drainage for someone who maybe has lymphedema following surgery. This is using just kind of precise light rhythmic motions to reduce that edema and hopefully improve function of that limb. And this is typically done by a physical therapist or someone who's trained in these kind of manipulations. And then reflexology, this is doing stimulation of different points on the feet or the hands, which can affect different anatomic organs and hopefully improve symptoms. And then something that I talk about a lot in my clinic, and I'm sure you guys think about quite a bit, is physical activity. Not only does physical activity improve your physical function, but it also can improve your emotional well-being. And I think being physically active and having a better performance status going into treatment often makes treatment more tolerable and can help maybe prevent adverse outcomes, but also help treat those adverse outcomes and make them more tolerable. So a recommendation from the American Cancer Society for people who are able to perform physical activity without limitations would be to do about 20 minutes of somewhat strenuous activity on 3 days a week. Or if you have more limitations or you're new to physical activity, you're trying to get back on an exercise regimen, starting very small with mild to moderate exercise and maybe 10-minute intervals for a goal of 30 minutes a day on 5 days a week. So something small like walking or getting onto some regimen with a physical therapist or with your local trainers who specialize in patients going through cancer treatment. Another thing that we're very fortunate to be able to offer at our institution with Dr. Francis, like I mentioned, is acupuncture. So when we think of acupuncture, we all obviously know about the needles going into different parts of the body, but this originates from traditional Chinese medicine. And the initial thought was it was regulation of qi by stimulating these different spots in the body with needles, heat, pressure points. And newer research is showing that there's changes in the brain and the neurotransmitters, the different brain area functioning when we're stimulating certain parts of the body with acupuncture. And so this can be beneficial for patients experiencing pain, particularly pain that is neuropathic. So I know following surgery, a lot of people have had nerve damage or they're complaining of numbness, pain, tingling in areas where they've had their excisions previously. And acupuncture may be one option to help try to mitigate some of those side effects of nerve pain. Nausea, vomiting could improve, and then dry mouth, particularly in patients, this has been researched in head and neck patients getting radiation, but it's improved dry mouth and that radiation-induced xerostomia or dry mouth. So one of the complaints I sometimes get from patients on immunotherapy is my mouth is dry and I'm not producing enough saliva. And this may be something as an adjunct on top of whatever your provider is recommending as far as medical treatment. And acupuncture should just be performed by someone who is qualified. Like I said, we're very blessed to have someone within our cancer institution. I know many cancer institutions around the country are developing these kinds of clinics and should be cautiously used in patients with bleeding disorders or on blood thinners. And that's why it's important to have a medical provider on the team while you're considering doing some of these different modalities. As far as the biologically based, I'm not going to talk about different supplements. Like Melissa had said, food is medicine, particularly when we're talking about immunotherapy and going through some of these different clinical trials, looking at how the immune system is affected by that gut biome. Using food as your way of getting these supplements is what's most important. But I know it's challenging not to go on the internet and see these new things that are coming on that are promised to improve outcomes or make symptoms more tolerable or cure cancer. These things are things that you need to absolutely discuss with your provider, because a lot of these can have direct impacts on some of the medications you're taking or on different organ systems and make the drugs that we're prescribing less effective or attenuate the side effects. So just before you take anything, bring it to your provider, have a conversation and see if there's anything that you should be worried about before starting that supplement. These are some different resources that you could utilize if you wanted to look more into some of these modalities. Like I had said, we're very lucky to have an integrative oncology division here at our institution, but there is a Society for Integrative Oncology, which has a website that is very helpful for where to get started on your research to make sure that you're using credible and reputable resources as you're looking at some of these modalities. And then this National Center for Complementary Integrative Health has many resources as far as clinical trials that have been done, where the academic research is on different things that you want to try. And as far as getting access to some of these different things I talked about, music therapy or art therapy, massage, things like that, talk to your provider, see if there's anything in your area that has these access to these things. Your local support groups or cancer, your community cancer centers may have things like this. I know we've got in Pittsburgh, our clubhouse, which has access to some of these therapists who specialize in music therapy or art therapy or group exercise options, which even during these COVID times are happening via Zoom, so you can do them in wherever you live. So are there any questions about kind of that broad overview of just different things to think about